responding to is Ian Johnson's universal healthcare in lieu of privatized healthcare would significantly improve the lives of all Americans. His supporting claims are that one, universal healthcare would be more cost effective. Two, universal healthcare would reduce private employers and employees' costs. And three, universal healthcare would improve the quality of people's lives. Now, for his first supporting point that universal healthcare would be more cost effective, the advocate uses primarily data taken from the 2000 World Health Report, which is prepared by the World Health Organization to illustrate that the U.S. supposedly does not provide adequate enough healthcare, despite the fact that we spend the most money per capita than any other country. These rankings are widely cited in public debates about healthcare as an objective measurement of ranking relative performance of other national healthcare systems, but the reality is they're not. Glenn Whitman, an associate professor of economics at Cal State Northridge, explains in his briefing papers to the Cato Institute that there are various underlying flaws to the World Health Report, such as the financial fairness factor, which accounts for 25% of the grading criteria. Now, the financial fairness factor measures the variance of the amount of percent people spend of their income on healthcare. He states that the financial fairness factor is not an objective measure of health attainment, but rather reflects a value judgment that rich people should pay more for healthcare, even if they consume the same. This value judgment isn't applied to other necessities such as food and housing. So under this reasoning, a rich person that makes 10 times as much as a poor person should pay $10 for a candy bar instead of $1. But instead, because that's financially fair. The advocate further supports his argument for universal health care by citing that the physicians for a national health care program, that more than 59%, or more than half or 59% of U.S. doctors now favor switching to a U.S. national health insurance program, and that fewer than a third oppose the idea. This is a logical fallacy and an ad populum or appeal to the people argument. The advocate disregards any possible agenda that the surveyed doctors may possess in wanting a national health care. He, however, unintentionally illustrates the flaw of this ad populum argument later in his third secondary claim, in which he cites that a problem with the current system is that HMOs, insurers, hire and fire physicians and employerships plans to take advantage of the lowest price each year. With the universal health care system, doctors would be guaranteed employment without fear of losing their jobs each year. So it's understandable as to why doctors would prefer a universal health care system instead of our current privatized one. Ultimately, all three sources he uses for his first secondary claim is from Physicians for a National Health Care Program, which from their website states that they are a single-issue organization advocating a universal, comprehensive, single-payer national health care program. Obviously, they possess bias towards universal health care and cannot be reliable as an objective source of data or information. He states to support his first claim that it's more cost-effective by saying that every individual is automatically covered. That would mean that you and I would have to pay more tax dollars because Jason over there smokes and doesn't take good care of himself. So, in terms of being more cost-effective, I'm not quite too sure about that. So, for his second claim, he states that universal health care would reduce private employers and employee costs. However, this isn't true, and in fact, it just redirects private employer costs and not reduces them. He shows this in his first secondary claim, where he cites that universal health care system would be financed by payroll tax on employers, which is about 7%, and an income tax on individuals. He says if companies were to eliminate their expensive healthcare costs, they could put the money back into their businesses, but he contradicts himself with his earlier evidence. In reality, the money, instead of going from businesses to the employees to the hospitals goes just to the hospitals, and that, or goes to the government than the hospitals instead. So in the end, there is no money, there is no cost reduction, just a redirection of resources. Again, another issue is that his primary source is the Connecticut Coalition for Universal Healthcare, which is a special interest group, and so they can't be reliable as their primary source of data. For his third claim, he states that universal healthcare would improve the quality of people's lives. France, which is ranked as #1 on the healthcare system by the World Health Organization, according to a Stockholm Network poll, the residents of France and Germany expressed the least satisfaction with treatment delays, or dissatisfaction with treatment delays, because the problem with free coverage is that it creates a lot of, by allowing more people to receive health coverage, it creates a lot of wait lists and a lot of delay. The implementation of a free healthcare system would cause a flood of free customers, and so you would have to wait a lot longer for a surgery. And so, as Ramesh Manuru, a columnist from Princeton University, demurs, if you can't get an operation because your country's national health insurance system has you on a long waiting list, in what sense would you have enjoyed a universal coverage? So overall, though, thus, while I cannot say that universal health care would not be more cost efficient, there's not enough sufficient data to support that it is in fact more